Greetings, it's your favorite massage therapist teaching you the melt method. And what we're going to do today is one of my favorite treatments to do on a daily basis. It's a mini hand treatment with a knuckle decompress. And these are techniques that I like to do first thing in the morning to get me going, especially after sleeping all night and not having a lot of productive lymphatic fluid flow or fascial fluid flow throughout the night. So this is a good way if you feel like you have stiff hands in the morning, or if you just want to feel that better mobility in your neck. If you feel a little stiff in the morning when you wake up, this is for you. So let's start with a couple of assessments. You will need for this treatment your large softball and your small softball. So go ahead and grab those, set them aside. First thing we're going to do is a movement assessment. So you're going to sit up nice and tall. You can be in a chair, you can be at the kitchen table, wherever you are, your office, doesn't matter. Sit up nice and tall, reach the crown of the head towards the ceiling. And release any unnecessary tension. If you're arching your back or anything else to sit tall, just let it go. We're just going to move our head here just slowly right to left. To you, it looks left to right. Doesn't matter. I just want you to turn your head a couple times and notice if you hear any noise. Does it sound like anything's grinding? Does it sound like anything's clicking, clacking, popping, snapping? What's your range of motion? Do you go further one side than the other? And do your shoulders come with you? Okay, not a crisis if any of those things are going on, but we are going to try to make some changes. So just notice what you feel. Next thing we're going to do, pick up your large softball. We're going to do a grip assess. So go ahead and grab the ball in each hand a couple times. You're not trying to give it a death squeeze. You're just trying to see, what does your grip feel like? So do you feel maybe that your knuckles want to pop, or it's painful to curl your fingers over the ball? Do you have tension that goes down the forearm? Does it feel like one grip is stronger than the other? Again, we're going to notice what you feel, and we're going to see if we can make some changes. Okay? So with the mini hand treatment, you can find a tabletop to stand over, or if you're on the ground like me, that's fine too. My treating hand, this is the client, this is the therapist, hand over hand. I'm going to start with the ball right smack in the middle of my palm, and I'm going to compress, and I'm going to wait. And I'm going to compress again, and I'm going to wait. This corresponds to our diaphragm. So it is in reflexology telling our diaphragm that we're providing some sensory input. And in a sense, it can help us breathe. So I highly recommend reflexology. It's a great practice. If you find a practitioner, stay with them. They're great at what they do. Compress one more time in the middle of the hand. And now we're going to roll the ball to the base of the palm. So this is where I'm at. I was up here before, now I'm at the base. We're going to make a little smiley face with our glide as we do this. So middle of the palm, I'm just going to scoop my hand up. My fingertips are going to stay on the ground. And I'm going to glide the ball in a smiley face shape from my thumb pad to my pinky pad. And I'm going to go slow. I'm not trying to dig a path into the ground. I'm going to go nice and slow, sensing for what I feel. I'm not trying to compress the ball so it pops, but I am keeping consistent pressure. Now, consistent pressure is important because all of the receptors in our hands like to have consistent input. So if you find that you're doing this and you're letting up at the end of each of your pass, your body's not getting the consistent message it needs to take in the information that we're doing some manual therapy on ourselves. So consistent pressure, pinky pad to thumb pad. Notice what you feel. Next time we get to our thumb pad, we're going to stop. My fingertips are still on the ground, and we're going to shear. So I'm going to brace my wrist. I'm taking my therapist hand, compressing down onto my client hand, and I'm shearing. So what this is doing is creating a local fluid exchange in the base of my thumb. So the base of the thumb has highly sensitized tissue, lots of fascia, lots of muscle. That's why we're going to shear only on this spot of our hand. And what we're doing is we're pinning the tissue against the bone, and we're creating a local fluid exchange. So then we're going to pause. Now we're just going to move our thumb around. So we're contracting muscle against the ball. And we're going to pause. I want you to take a breath in to the spot that's connected to the ball. Now we're going to do the same thing on the other hand. So now this hand is formerly the therapist, now is the client. I'm going to put my hand right over the middle of the ball. This hand is now the therapist. I'm going to press down, and I'm going to compress and wait. Now, if you can shake your elbow of your client hand, that's good. If you can't because you're jammed up into your shoulder, let it go. Back off, compress again. The therapist does the work. Back off, compress again. And one more time, back off, compress again. Keeping your fingertips on the ground, you're gonna gently just roll that ball to the base of your palm. Again, we're going from thumb pad to pinky pad. I'm gonna take my therapist hand away so you can see a little bit better. It's like my hand is swiveling. Now I am having to use some muscle down my arm. That's why I like to have the therapist hand come in and just provide the pressure so that way my glide can be nice and easy. My elbows are relaxed, my shoulders are not climbing up towards my ear, and I'm going nice and slow. Keeping my pressure consistent, super important. Fingertips are on the ground. And when we get to the thumb pad again, we're gonna pause. Again, I'm gonna brace my wrist and provide a downward pressure, and then I'm gonna shear. So maybe from this angle, you can see a little bit more that I'm taking the large soft ball and I'm kind of creating a local fluid exchange in my thumb pad, kind of pinning the tissue, swishing it around, but I'm not rolling the ball on my thumb. And then I'm gonna pause there. Now I'm just gonna move my thumb. So you should feel the muscle of your thumb pad contracting against the ball. This is what we call an indirect shear. Pause there, breathe into the spot that's contacting the ball. Now we're gonna set that ball aside, grab your small softball. We're gonna do a knuckle decompress. This is fantastic if you feel in the morning you have puffy fingers, if you have pain in your hands, any inklings of wrist pain. So what we're gonna do, we're gonna place the ball in between the web of the fingers. We're starting at the first two, and you're gonna squeeze. What we're trying to do is create a little divot between the tendons on the back of our hands. This is allowing fluid to flow up the arm. Okay, and we're gonna squeeze a couple times. If it's painful, don't squeeze so hard. And if it feels like that ball's gonna pop out, phone a friend, your other hand, and squeeze the ball, okay? Let's go to the next set of fingers. Looking down at your knuckles, seeing that you have that nice gap, that nice space. If you do have a nice gap, it could be because there's a lack of fluid, right? If you're a little dehydrated, but it also could mean that you're just opening up, and then we're gonna get some nice fluid flow in there. Last two, ring finger and pinky. Now for me, this is a little weak. You might find that you do need the extra help here, and that is totally fine. It's not about can you squeeze the ball or how much control do you have. It's about mobilizing these joints. The last one we're gonna do, place this ball in the thumb pad, wrap your thumb around. I like to wrap my index finger around too, so with the right kind of ball, like a bouncy ball, it'd pop out. But then I'm gonna squeeze, or I can do the squeezing for my hand as I mobilize this thumb joint. Super important. Let's do it on the other side. So between the first and the second finger, closest to the knuckle and the web of the hand, you're doing a couple squeezes. Maybe you'll find that one side is a little stronger than the other. That's okay. We're still in the process of making changes. Let's go between the middle finger and the ring finger. I definitely have some weakness on this side, so I'm gonna go ahead and give myself a hand and I'm gonna do the squeezing for me. Last time, I'm gonna do my ring finger and my pinky finger. Again, noticing the sensations. If there's any struggle, weakness, maybe it feels fine to you. All is good, all is information. Lastly, take the ball into the web of the thumb, protect it with the thumb, wrap the index finger around, squeeze. It kind of reminds me like, when you ever draw those little smiley faces on your hand and you talk? That's kind of what I'm doing. So, couple squeezes there, and let it go. Set that ball aside. Now we're gonna rinse. So now what have we done? We've allowed a lot of fluid to be released from our joint capsules into basically the back and the front of our hands. Now we're gonna take that and we're gonna rinse it. So rinsing is one directional. My hand goes on the ground. I take the large soft ball and I'm gonna rinse my fingertips from base to tip. Each finger, one direction, helping that fluid on its path to go up my arm, up to my neck and shoulders. Okay, as an aside, you can put your fingers together and do them all at the same time. That's okay. Don't forget your thumb. Your thumb is very important. Without our thumbs and our sense of grip, that actually does affect our arm line all the way up to our neck. Our thumb is part of our suspension muscles, right? So anytime you need to hold something, carry a suitcase, carry a bucket of paint, whatever, do pull-ups, that's all related to your thumb, so very important. Okay, let's switch hands. So other hand comes down, I'm gonna take the soft ball, I'm gonna rinse up from the base to the tip, Doesn't matter the pressure here. Sometimes it does feel good to give yourself a little oomph, press down a little bit. It's just that nice friction on the back of the fingers, rinsing that fluid up and over the fingertips. That feels really nice. Again, you can put all fingers together. No need to go over the back of the hand, right? We don't go over the back of the hand so much because the tissue on the very back of the hand can be thin and delicate, especially in the winter. So we don't need to irritate it if it tends to be thin and sensitive anyway. No crisis if you do. Let's finish this rinsing pass one more time. The last thing we're going to do is friction. So now we're going to take the large soft ball, place it between our hands, and gently just rub the ball together. We're stimulating the pre-lymphatic channels. We're helping any other fluid move to where it needs to go. And breathe in. Okay, so let's come back and let's see what we've done. So just kind of sit here for a second. Notice if you feel any kind of tingling or buzzing in your hands and your arms. That's fantastic. That means that we've achieved the fluid flow that was in our hands, going up through our hands and our fingers, now up to our arm, and it's going to help out our neck. Let's check our grip. Let's go back to that grip assess that we started with. Has your grip strength changed? Are you more even, side to side? Is it easier to curl the fingers around the ball, whereas before you might have had a little bit of pain in your knuckles? It's definitely easier for me. And if you had any sensations of stress going down your forearms, has that subsided? Because for me, it definitely has. As a massage therapist, I do tend to get pain in my wrists a lot. So anytime I can get any gains of feeling that pain be relieved, very helpful. Let's set that ball aside. We're going to do our neck turn assess one more time. So find the same seat you're in. I want you to find the same location that you looked at the first time. Sit up nice and tall. Reach the crown of the head towards the ceiling. Go ahead and turn your head side to side a couple times. And notice how much range of motion have you gained. You might be able to see a little bit more behind you. And if it didn't result that you have a range of motion increase, maybe the fluidity of the movement is better. It might feel a lot smoother to do your neck turn. So that is my favorite mini hand treatment with the knuckle decompress. Again, you can do this in the morning. You can do it before you go to bed. Highly recommend if you have any sort of neck issues, inklings of carpal tunnel, or if you work at a desk or you're picking up kids, or if you're driving a lot. How about all of the above? So thank you.